Most people hope to age in their own home, but seniors and their families don't always have that choice. Four health policy experts, Dr. Robyn Tamblyn, Dr. Ivy Bourgeault, Dr. Neena Chappell, and Dr. Michel Grignon, believe it is time to rethink the philosophy behind long-term care in Canada. We can no longer accept the status quo, says Dr. Tamblyn.
So there's a number of issues, and we're spending an awful lot of money, not in very wise ways. People got this idea that you retire at the age of 65. If you're unable to really live independently in your home, the only route is to put you in a long-term care facility. I don't know if you've ever been in a long-term care home. They're like hospital warehouses for humans. So this is the time for let's learn faster, let's fail faster, let's figure out how to do this better.
Long-term care needs to be taken more seriously and better reflect the needs and preferences of seniors, insists Dr. Chappell.
Primarily what they need are types of care, particularly what we consider home care. Old people, just like all the rest of us, don't want to end up in an institution. We want to stay in our own homes. And the vast majority of old people, even with a number of chronic conditions, are able to do that, but often need assistance in order to do that. And the types of assistance they need are the types of assistance that are provided in home care. But a lot of what's required are what we think of more as social care rather than medical care, which is one of the reasons why those types of services have a difficult time receiving support, because they're not considered medicine per se. Those sorts of services are still looked down upon. They are much cheaper than medical care, and it is that type of care that most older adults require in order to stay in their home.
Dr. Tamblyn believes there needs to be a different approach in managing chronic conditions.
The second part is that we need to get smarter about how do we manage chronic conditions. You don't manage chronic conditions by putting people in the emergency department to refill their prescriptions.
Simply adding beds in nursing homes is not the answer to an aging demographic. Rather, healthcare professionals and politicians need to think outside the box and look for innovative projects in order to restructure long-term care.
And the long-term care facilities were built like the hospitals, whereas Denmark hasn't built any new long-term care facilities. They haven't built any. We've created these silos, and we can't seem to get out of those silos. So it's really having that vision, direction, public support for it.
Dr. Tamblyn adds that technology companies are developing neat devices to facilitate home care, from companion robots to smart clothing that recognize if you've fallen and appliances that turn off by themselves. And in some European countries, locking down seniors because of dementia or Alzheimer's is not an option, adds Dr. Bourgeault.
It would be inconceivable in a Canadian context because we are so risk adverse. And again, looking at care as in care for the living, that this is a residence. These are places where people live.
But Canada is innovating in certain areas, namely in e-health. For example, in New Brunswick and Newfoundland, seniors, doctors, and their families are using technology like Skype to ensure community-based care.
It's a way of connecting with your grandchildren, your sons and daughters, and they can connect with you and they can look after you virtually. And they could oversee what's happening. And it enables people to do things differently than they could have done before and actually be supported and reinsured.
But one of the obstacles in making home care more available and affordable is that Canada tends to subsidize the cost of nursing homes much better than home care, explains Dr. Grignon.
So in some instances, there might be people who are institutionalized simply because at the end of the day it costs less rather than to keep them at home, even though that would cost less as a whole.
Another issue is that Canada is not giving caregivers the resources they need, believes Dr. Bourgeault.
You can't just say we're going to keep care in the home but not resource that appropriately. We just ignore it, or we just rely on family caregivers. And so, we save money in the system on the backs of family care providers who then, are so exhausted because they are relied upon to do tasks that really they are not trained for, they don't have the competency for, and they don't have the resources. You have now created a precarious circumstance for both the older adult that needs care and the one who's providing the care.
Ultimately, the baby boomer generation will be the one driving the changes to the healthcare system, believes Dr. Tamblyn.
This baby boom population actually is a different crowd altogether. Their focus is on being healthy and staying independent and active. It will be consumer-driven. They'll fundamentally change the way we deliver healthcare. And it will break this kind of freeze that we've gotten into of being unable to move the system.
For Evidence Network, I'm Melanie Holoboski.